Fox 10 Extra News at 7 starts now.
Thanks for watching Fox 10 Extra News at 7. I'm Christina Carilla.
And I'm Mark Martinez. We continue tracking the coronavirus as the country continues to prepare to reopen. And today, President Trump held a call with faith leaders about plans for a phased-in return. Yesterday, we stood at a little more than 4,200 cases in Arizona, but today that number has climbed to more than 4,500. That's a jump of 273 since yesterday. As we do more testing in Arizona, this number will naturally go up, and the deaths right now are up to 169. Yesterday, Arizona was at 150.
Scammers are looking to take advantage of people right now. Google says Gmail users are being sent 18 million scam emails per day. They say that 1 in every 5 emails is related to the coronavirus and is a scam. Some scammers even posing as the World Health Organization.
And Christina, the FBI says thieves are using COVID-19 as a way to commit healthcare fraud and more. Fox 10's Bailey Miller has more from the FBI.
Yeah, the FBI here in Arizona is saying they're getting hundreds and hundreds of calls every single day about different kinds of scams. They say these scammers are knocking on doors, making calls, and posting on social media, and it's all about COVID-19. The FBI monitoring fraud schemes during this pandemic closely. The most common in Arizona involve healthcare billing, price gouging, news of fake cures, and counterfeit PPE.
We anticipate seeing a significant rise in traditional healthcare billing fraud as more and more patients are seeking treatment for COVID-19 and providing their insurance information to potential bad actors.
The FBI says the perpetrators only need 2 things to succeed in healthcare billing fraud. That's insurance information and a prescription. They say to be aware of anyone soliciting this information and add that you should not be getting unexpected calls about COVID-19.
So we'd like people to be extremely cautious of unsolicited contact from individuals or companies trying to convince them to either get tested for COVID-19 or asking for their insurance information.
And the FBI says to be aware of any calls saying that there is a cure or a new test kit available. They say no one will be calling about those things. They are also adding about fake PPE. You can check the CDC website to make sure you are purchasing the right PPE. And if you are a victim of crime, you can report it to the FBI. Reporting live, I'm Bailey Miller, Fox 10 News.
Thank you, Bailey. And tonight we're getting a better idea of just how many small businesses in Arizona have been approved by the Paycheck Protection loans. According to the Small Business Administration, more than 19,000 businesses have been approved for loans for a total of $4.9 billion. But to put that in perspective, there are more than 500,000 small businesses across the state, and more than half have applied for loans. The average loan amount per business was just over $250,000.
Although millions of people are newly unemployed now, there are dozens of companies looking to hire more people. Nicole Garcia has more on opportunities with locally owned businesses.
The medical marijuana industry is one of many that appears to be immune to the negative effects of coronavirus. The Mint dispensary has seen an increase in customers in the last several weeks and is looking to open a 3rd location soon.
Right now we need accountants, we need leads, we're looking for packagers, we're looking for PSRs, the people who are on the front line talking to the patients.
The Mint has about 40 immediate openings, from entry-level to skilled and managerial positions. The pay ranges from $13 an hour to 6-figure salaries.
We have the higher end jobs, which is the cultivation, somebody working in the lab. Once again, we need an accountant controller, so at that point, they need a certain skill set.
And thanks to small business loans, many other companies are staying afloat and can now afford to recruit more workers. Phoenix Staffing is one company that was hit hard. They provide workers for apartment complexes, which have cut back on hiring out work.
We were averaging about 180 people, working a week. We're down to 30, 45 people or so.
But he anticipates a surge for his staffing service once the shelter-at-home order begins to ease.
Just in Phoenix alone, we'll probably be hiring 40 to 50 apartment maintenance technicians and leasing consultants and managers. And a lot of our clients will be coming back on board to get their apartments staffed and taken care of.
Nicole Garcia reporting tonight, and emergency responders are now being impacted economically by the coronavirus pandemic. Maricopa Ambulance, that is, furloughing nearly 100 employees due to COVID-19. In a statement, they say that stay-at-home orders has declined the demand for services. A drop in transports means a drop in revenue. One EMT who wants to stay anonymous says there may be unintended consequences.
The thing that boggles my mind is they are 100% short-staffing the areas that we service. So let's say that there's 4 ambulances on and 6 calls go out all at the same time, which has been known to happen. Where are they going to get those other 2 ambulances from?
As for health benefits, furloughed workers must keep paying their insurance during this temporary period to stay covered.
Protesters outside the home of the Minnesota governor's mansion demanding an end to what they call the state lockdown. The governor was already preparing to relax stay-at-home orders and will allow outdoor recreation to reopen tomorrow. The White House has introduced guidelines to jumpstart the economy, outlining 3 phases for states to gradually reopen. President Trump is ultimately putting the responsibility on the governors of states to come up with a plan. Some state leaders say it gives them the autonomy they want, but others say it leaves them out the money they need.
Is there any funding so I can do these things that you want us to do? No. That is passing the buck without passing the buck.
The plan that we're already discussing for Iowa really does align very well with what the president's plan is. So there's a lot of similarities that we all have been looking at as we talk about targeting and then responsibly reopening our states.
There's no strict timeline here. The federal plan doesn't even list dates for even a partial reopening. Some governors are looking at May 1st, others at June. Still, without more testing, most governors won't commit to a specific time frame.
Arizona, one of many states looking to reopen as people are eager to get back to business as usual. Several protests are planned this weekend to urge the governor to reopen the state. Brian Webb has the story.
Welcome aboard Arizona's COVID-19 roller coaster. You are about 10 days away from reaching the top, according to ER doctor Frank Lavecchio.
The peak is when we'll be utilizing the most hospital resources.
This graph shows Arizona's cases over the past 2 weeks climbing steadily up the curve. Same with the state's death toll, now standing at 169. But even after we reach the peak, COVID-19 won't disappear.
It's not an on-off switch. It's more of a dimmer. This is going to go away. It's going to come back a little bit, go away, come back a little bit until we all get vaccinated or have had the disease.
This week, President Trump called for reopening states in stages, starting after a 14-day drop in cases. Dr. Lavecchio hopes politicians take it slow and that people take it easy. The lack of widespread testing means much of the virus is lurking in the dark.
And we hope with antibody testing and with more accurate sort of virus testing that we'll get there. We're not there quite yet.
The doctor says the COVID-19 roller coaster ride will likely last for more than a year with smaller peaks and valleys until this scary ride finally comes to a stop, either with a vaccine or when we reach what's called herd immunity.
And the herd immunity magic number for something like measles is over 95, closer to 99%, so people around you don't get it. For this, it's closer to about 50, probably closer to 60% of people around you, then you'll be protected.
Brian Webb, Fox 10 News.
Several Native American tribes have filed a lawsuit against the U.S. Treasury Department over $8 billion in federal COVID-19 relief for tribes. Some of that money is earmarked to go toward for-profit Alaska Native corporations. The Navajo Nation joining the suit, arguing the corporation should not be on par with tribal governments. Tribes are relying on the cash after having to shut down casinos, tourism, and other businesses that serve as their main moneymakers. The Navajo Nation has reported more coronavirus cases than any other Native American tribe, with more than 1,100 confirmed cases and 44 fatalities.
And with limited access to health care and an older population, tribal nations are particularly at risk when it comes to COVID-19. Fox's Ben Brown has the details on how these rural communities are fighting off this deadly virus.
We have a lot that have underlying health issues. So if, it were to get here, it would probably wipe out our community.
This is the concern shared amongst many of the 500 plus tribal nations spread out across rural America.
Our people suffer disproportionately unfortunately, from diseases like diabetes, hypertension, asthma, cardiovascular disease. We are basically like the profile for what the CDC says. These are the most vulnerable populations.
Like most of the country, tribal nations lack adequate supply of personal protective equipment, like masks and gloves and COVID-19 tests.
But if you're trying to fight a fight without any weapons, without any armor, what are your chances?
Despite taking precautions, as early as January, the Navajo Nation has been one of the hardest hit tribal communities, with more than 900 confirmed cases and over 30 deaths.
I think our healthcare professionals, our citizens heeded the warnings, but it snuck in, it snuck in. And
limited access to test kits and protective gear, coupled with an aging healthcare system, creates a recipe for disaster.
The average age of our facilities is 36 years. The average age in the healthcare industry is 10 to 11 years. So that in itself comes with its own challenges. Again, with our hotspots, we are getting close to the tipping point.
The Indian Health Service received just over $1 billion in funding from the CARES Act to help in the fight against COVID-19. And while the agency is pleased with the government's response, some tribal leaders feel differently.
There's just been a history of broken promises from the federal government, but we're not going to cry over spilled milk, as they say. We're going to continue to do what we need to do to protect our Navajo citizens.
As Native communities enforce different measures like curfews and restricting access to the reservation to prevent the spread of COVID-19, tribal leaders say without testing kits, it's hard to tell whether they're actually winning the fight against this deadly virus. In Las Vegas, Ben Brown, Fox 10 News.
Still to come, in-person services at the Motor Vehicle Department officially closed. Why they're using this time to make improvements. Plus, former Arizona Governor Jane Hull has died. How she's being remembered as an Arizona political trailblazer.
Fox 10 News, when it matters most. It's our commitment to bring you news and information to help keep your family safe. Fox 10 News is ready on air, online, and on the go. From the news team you know and trust, Fox 10 News is the place to turn when it matters most.